Well, let's get into your wheelhouse here, James, and I think it's healthcare. I mean, I think you have some real experience in creating some healthcare options internationally. Is that right? And you've drafted some things.
Yeah, I've done a little international business. I kind of fall what they call on medical futuristics. But I've been involved in building health plans at the state level, workers' comp and group health, combining the coverage together so they would call it 24-hour coverage. So I have that years of experience, also Medicare, Medicaid, Medi-Cal. So I know those environments really well, the different legislation and the policies and the compliance issues. So dealing with the Obamacare and the healthcare reform is something that I really want to jump into. And what I find shocking, as I mentioned earlier, was the Medicare for All. That was a plan, I think, if it was refined, I think it would get a yay vote from both sides of the aisle. Because that truly is a system that's in place, that's working fairly well, that needs to be refined with some medical futuristics. It's a new refinement in technology to increase the level of care, increase the quality outcomes. Because there's so many studies out today. Yeah, this is my wheelhouse, by the way. And I'm very passionate about it. The longevity in life, there's no reason why anyone today, depending on the genetic makeup, there's things that can deal with genetic issues as well, that we can't live longer, healthier, and a more stronger quality of life. So I want to tackle this. I think that we owe it to us and our parents, because they're in that generation now in Medicare, and of course our youth, but opening it up. We want to make this the universal healthcare coverage, but also making it available to have private care, private insurance as well. So you want to have that availability, because those 1%ers, those billionaires, may not like the universal coverage. They may want to just have their own hospital. You follow me?
Mm-hmm.
So I think that's probably we need to revisit the expanding Medicare for all.
There's a formula there that it would create some extra competition that would kind of hold insurance companies to a little bit of a fire, or just give consumers options?
Both. You want to, because I'll admit that healthcare payers can be rather greedy, but they have certain laws they have to adhere to too. Here in California, it's called limited Knox-Keene license, that they have strong compliance. It's more on the fiscal or the financial side, but also quality outcomes. So they've, with the new Obamacare, it's kind of blown up a little bit. A lot of payers or insurance companies have left the industry. It's created this dynamic in the market where you have just a few large healthcare coverage, healthcare carriers providing these services, and many of them are leaving the state. And why they're leaving the state is because of what they call the level of claims and the severity of claims, because it's a higher risk profile for a given region. So but yes, we want to increase competition if there's a way to do that, but it would probably be on the private side. But those that are seeking universal coverage, I think this is the answer. We just need to revisit it and just fine tune with what I share with you. There's technology out there that will simplify the administrative process, reduce the layers within administration, because that's really where the costs are skyrocketing, is you have too many layers. We want to reduce layers through automation. And those people that we displace from that process, let's re-educate them. Let's get them back into whatever level of what industry they want to be in. There's no reason. Like, I still go to school myself. I still go to UCI looking at predictive analytics. So give them that opportunity to go back in. And I'm covering a lot of bases, but I'm really passionate about healthcare because I know the ripple effect and the net change it would have on the industry as a whole when you start kind of collapsing it. But all in all, I think that's truly one answer, but I have yet to see the other healthcare reforms. The Republican plan I didn't really go into in great deal. I did review Obamacare extensively, and I've seen over the course of several years now, the premiums increase. the level of coverage going down. Yeah, so those are the areas that we're going to focus on.